Canada for 20 years, and I came here because I was mad. I was damn mad. And that occurred because healthcare in Canada had deteriorated to the point where I could not provide service and care for the people that I saw as clients. On top of that, there was a little bit of a government conspiracy that was carried out through the public media, what they call the Canadian Broadcasting Association, that was laying the fault of the costs of healthcare on the physicians, saying that we were abusing the healthcare system, providing excessive service to line our own pockets. Now, healthcare in Canada initiated with the first Canada Health Act in 1962, and that's when healthcare became universal in Canada. And it was a pretty straightforward service. There really wasn't much in the way of specialty care in those days. Matter of fact, in 1967, the first intensive care unit was put together in Seattle. At that time, we didn't know much about sick people. We just put all the really sick ones together and watched and saw what happened. Things have progressed a lot since that time. About 1970 was about the turning point at which we came into the modern age of medicine. And at this stage, for the first time, we could determine things that were going on inside of a person before we cut holes in them trying to find out what was going on. Imaging studies, various types of testing, things that we had only dreamed about in the ages before. I remember in 1973 when I was training at the Mayo Clinic, a specialist came in to show us these fuzzy pictures on slides on the wall, and he was talking about something called ultrasound, and all of us in training were looking at these fuzzy pictures, and we said, "It ain't going to fly." Well, 30 generations of development later, and it's actually flying quite well, thank you. The trouble is, the cost of healthcare got ever increasingly higher as it got more complex. And at that time, there was a great deal of government spending going on through 17 years of Liberal government. Some of you older folks might remember Pierre Elliott Trudeau. Trudeau was a great Liberal. Surprise, he was a lawyer, and surprise, he was a teacher in a college in Montreal, and surprise, he always wore a dapper suit, always had a carnation in his lapel, and during his presentations when he was campaigning as Prime Minister of Canada, everybody would faint and fall in the aisles. They called it Trudeau-mania. And we can see the comparisons to our current leadership there as well. But like our current leadership, he spent money like a drunken sailor on furlough. And like our current leader, he was trying to make changes in the social structure of the country. He introduced metrification, trying to emulate European standards of measure. He introduced multiculturalism, trying to dilute some of the French problems in Canada. Those of you who know realize that the French were trying to pull away from Canada as a group. So these were various things that he was doing to try to keep the Confederation together, but it was costing hand over fist money from the taxpayers. And of course, healthcare started getting real expensive with all these things that were going on. So come about 1990, they start saying, holy mackerel, we can't spend this money on healthcare. We've already spent it on all these other programs that we want to do. So we need to find a way of limiting services. And I actually participated in a number of town hall meetings where we gave presentations on the direction that healthcare should go into. And they had all these presentations, and in the end, after about 2 years, they said, the people want less healthcare. Now, having attended those same presentations, I don't remember that. But come along early 1995, they started closing hospitals. They started closing them wholesale. Across Canada, over the year, they closed 50% of every bed. Every acute care bed, every emergency room bed, every operating room bed, every senior citizen's bed, because they were going to control the costs. They made it illegal for us to have labs in the clinics. You now had to go to see your doctor, doctor wanted tests, he would now send you to the state lab. They took the x-ray services out of the clinics, and they said, now if you see your doctor and you need an x-ray, you've injured yourself, you're going to send to the state x-ray facility. So you see your doctor, you walk over to the state lab, you drive over to the state x-ray place, next week you make another appointment to come back and get the results. It makes it really hard to treat a urinary infection or a broken wrist. Now, I have to be a little careful because some of the Canadian services aren't that bad. You know, they are pretty good at dealing with the bad stuff. You have a heart attack, gash yourself with your chainsaw. You know, these things are going to be cared for. But the everyday aches and pains and gallbladder attacks, arthritic problems, and illnesses of aging basically wait. And you can wait a long time. I think probably the best example I saw was one of my younger brothers was in a skiing accident, and he tore the Achilles tendon on the back of his ankle. He was directed to go to emergency room, waited about 5 or 6 hours to see the emergency room physician, who said, yeah, you tore the tendon, that needs surgery. So I said, okay, what do I do? He said, well, you can talk to your doctor about getting an appointment. And he said, well, the last time I did that, it took 2 months. I said, well, if you wait here in the emergency room, one of the surgeons will be free between cases and they'll come and have a look at you. So he did that in another 8 hours. The surgeon came to see him and says, yep, you've torn your Achilles tendon, it needs to be repaired. But he says, I don't have any beds. There's no beds open in the hospital. So my brother said, well, what can I do? He said, well, you know, what I'll do is I'll wait for an open space in surgery, and if you're still here and if you haven't eaten or drank anything, we'll do the case for you. So my brother said, okay, and he waited another 36 hours in the emergency room without eating or drinking. And lo and behold, the surgeon was true to his word. He found a spot, took him up to the operating room, and a while later my brother woke up sitting in the same chair in the emergency room after surgery. He'd been in the emergency room 56 hours. The reason he got care was basically because he was patient enough to wait. How many of us would be patient enough to wait? If you go to an emergency room in Canada, you have a 50% chance of being seen. Basically, they triage the people there, and they say, you're not sick enough to be here, go to one of the walk-in clinics tomorrow when they open. And I'm not sure about you. You know, certainly when I was faced with this in Canada, I said I can't practice this way. And actually, I came here to town, Margie Hendrickson, bless her soul, came to town, and Fane Stenhouse also came to town. So there were 3 of us. 600 physicians left Alberta after being basically insulted over their services. 6,000 physicians left Canada. They have still never made up the numbers, and it is still difficult to get appointments for a lot of everyday things. And I just want to plant those ideas with you, because once government takes care of health care, and once they put it on a budgetary cycle, and once the money runs out, you're not going to get the care. Just a word for thought.